Dear all, it is with great satisfaction that I am closing this event tonight. After 4 days of hard work, I have seen many good things. I have seen that all the people that got involved in this project had benefit from it. You, as a trainees, had become more skillful in the science and art of implants. Our UFM residents have had the access to first-class speakers and lectures, and also has experience to see all of you working as a team. But most important, our patients. They have had the opportunity to have a treatment that otherwise they cannot afford. Thank you very much. You see how appreciative they are. We, as director of the dental school at UFM, were very confident of the success of this seminar because we know Dr. Termechi. We know how hard he works. He knows how he pursued excellence. And a proof of this confidence is that many of the patients that you treat were the relatives of our students and close friends of us. We want to thank Dr. Corey Glenn for sharing his knowledge with Dr. Clay, our radiologist at the school, Dr. Takanori Suzuki, Dr. Samuel First, Dr. Roberto Galindo, Dr. Luis Grisolía, Dr. Rodrigo Cayarga, and of course, Janet Santiago, and all the UFM personnel that make this possible. We invite you to visit Guatemala in the future. We have beautiful lakes, beautiful mountains, volcanoes, a beautiful culture, but most important, we have a beautiful people. I would like to take a moment just to honor a visionary that was the leader of our dental school for more than 35 years. Our former dean, Dr. Ramiro Alfaro, foresaw this dental school as it is today, and he worked hard to fulfill his dreams together with a group of collaborators. In this dental school, we are family. We work together and we work hard to teach the science and art of dentistry in a different way. Thank you very much.
UFM School of Dentistry was founded in 1979 as a private nonprofit university. With 40 years history and teaching, our mission is to teach and disseminate the ethical and legal and economic principles of a society of free and responsible persons. We're committed to excellence in learning. We seek to be the #1 choice of talented students in Latin America. Technology, innovative technology to enrich the UFM experience. This was the School of Dentistry building back in January 1985, and it has been a long way, but look where we are now. A School of Dentistry has first-class facility, equipment, and faculty.
great experience. Placed a lot of implants. Learned a lot about implants. So thank you.
Now, I just wanted to, again, emphasize on this and really thank you for putting your education in implant dentistry in the hands of the ISS and UFM. We really went through a lot of effort to make this course what it is, and I know you guys went through a lot of effort just to get down here and get the learning that we were here to teach. There was you guys came as strangers, but you leave here as family, and you're more than welcome to come down to Guatemala whenever you guys want. We love doing this stuff because our residents get a lot of experience out of this, our patients get a lot of benefit, and our faculty we get a lot out of it as well. I had no idea about all the things Corey could do in the computer. All right. So thank you again, and thank you for a great week. I'm going to leave some words of our DISS founder, Dr. Omid Merchi.
I remember when I was in NYU, and every time we had either our end of the year party, or if we had our holiday party, and Dr. Tarna used to get up and say, you come here just like Dr. Kayarga said, you come here as strangers, and now you are part of a family. And please don't hesitate to stay in touch. I'm going to make that slightly easy on social media for all of us to be able to go ahead and interact with each other, from students to faculties, so we can learn from each other. Because at some point, you guys are going to come, and we will be looking forward to have our students to become better than their teachers. That's even more enjoyable to us. I have so many people to thank, and I hate to go ahead and miss people, but I'm going to try my best to go ahead and thank the people who are really responsible to go ahead and get this, vision to come true. Dr. Mata, he's been amazingly gracious to allow us to go ahead and come here to UFM and be able to go ahead and do this. The past couple of years I've been coming here, I've seen nothing but amazing reception from people here. From the dean, from the vice president, from the Dr. Kayarga, Dr. Galindo, that, I used to text him at 12 o'clock at night, 1 o'clock in the morning, did you do this? Do we have this? Don't we have this? And, he was on vacation in Paris, and he says, Dr. Shimechi, I can't do anything. I'm on vacation in Paris. When I get back, I'll take care of it. So, it was a lot of things that we had to go ahead and get together. The faculties who, Dr. Samuel First, Dr. Corey Glenn, of course, Dr. Takanori Suzuki, these are, top-notch people that I handpick to go ahead and give our students the best opportunity for your future as you coming along. But to not want to leave anybody out are the residents and the students of UFM, because without them being in the clinic next to you guys, translating for our patients, without the staff, without the cleaning people, who after we make a mess after every session, they're there cleaning up, and we come back and it looks like it's a brand new clinic. I mean, every little thing, these people all have hands in what we did. So I'm trying to think. I'm not as eloquent as Dr. Mata is, but I'm trying to think to not leave anybody out. I wanted to thank my secretary, Janet Santiago. I wanted to tell you, Janet, that if it wasn't for you and for me to be able to delegate all this work to somebody and dump, and Dr. Glenn knows that anytime I want something, what do I say, Corey? Yeah, here we go. And that's what it is. I wanted to thank you very much for putting up with me and my craziness, and to try to go ahead and get this going. Last but not least is my lovely wife, who came here to surprise me. And it's such an amazing surprise. I did not think that she would want to go ahead and come this time. And we planned it for her to go ahead and come, but thank you, Sarika, for coming. Of course, Sylvia, who is always been Cecilia has always been the backbone of the clinic as far as making sure everything is smooth. I mean, we go from this room after the lecture into the clinic, and all of a sudden, all the food gets transferred there into that room and the refreshment. I mean, it just doesn't magically happen that way, okay? She's behind it. So I wanted to thank you very much for putting up with us. There's one person in specific that I don't want to leave out. If it wasn't for him, it would probably be extremely difficult for myself, for Dr. Kayarga, for Dr. Galindo, and anybody who I was in contact with to get this happen. So I wanted to ask Fernando to come up, please. Yes, absolutely. Absolutely. To just give you an idea, Fernando took from the radiologist every single scan, uploading it to me, and the SDL files, uploading it to me, texting me on WhatsApp, the patients scanned this, scan this, scan this, SDL this, SDL. Put it in my Dropbox. I go in there and I take it out. Fernando, you're missing this. Oh, okay, Dr. Termecci, I'm in the class right now, but I get it done in a few minutes. I mean, just everything. And then I'll send it to Corey, and Corey looks at it and says, oh, the teeth are cut off, Omid. I can't do anything about it. I'll talk to you later. And then I come back to Fernando. Fernando, the teeth are cut off. You got to go to the radiologist. Oh, okay, Dr. Ritchie, I'll do it. So bottom line is, he has been, behind every single scan that you looked at and planned and so on and so forth. He has been behind it. And every patient that we assigned, he has been behind it. And he does it with such gracious demeanor and smile on his face, and with no, I'm tired, I had it, it's enough. So I wanted to thank you very much for putting up with me. I have something for you. Oh, thank you. Okay. It's nothing much, but I just feel like, I wanted to give you my appreciation for just being there and putting up with all the things that I put you through, okay? I appreciate it, thank you. All right. Last but not least, of course, the DISS residents. I mean, the truth is, you guys, as much as we're starting something new, you guys are the pioneer of this course. I hope you enjoyed it. And I tell you, we couldn't do it without you. Not much I can say. And just like Dr. Mata said, you did a wonderful thing by coming here, just simply helping people of Guatemala. And the fact that we get all these relatives and so on and so forth to come in and put the trust in our hand. And I want to tell you one thing. I have seen the panoramic x-rays of your surgeries at the end of the day with Dr. Kayarga. And every single implants I'm looking at, if anybody would look at those panoramic x-rays, they would think that expert periodontist, oral surgeons, so on and so forth, place those implants. So I want to give you guys a shout out. And a big hand. Just to put up with us and come in and do this, it's fantastic. We're very proud of you. And I hope that we gave you something new that you could go ahead and Monday morning get cranking at it and go, and hopefully this would be a great success for every single one of you in your future, and hopefully to see you back with advanced courses and things like that. So we would like to go ahead and be in touch with you, and thank you for joining the DISS family.
Now moving along, we're gonna start giving out some diplomas to you guys. You didn't even know about this. But it's like your graduation ceremony. So Dr. Termecci, Dean Mata, please join us here in the front. Dr. Richard Bledsacker, or Bloodsucker. Dr. Abe. Dr. Stuart Feintuck. Dr. Bradley White. Dr. Tara Clements. Dr. Frank Liu. Dr. Jake Owens. Dr. Kim June. Dr. Casey Travelstead. Oh, it's a mere Morphin. All right, we also want to acknowledge our postgraduate UFM residents. So Dr. Grisolia, please. Dr. Juan Diego Quiñones. Doctora Alejandra Montoya. Doctora Claudia Aguilar. Edward Bach. Doctor Limón. No. Doctora Jamie Salgado. Doctor Rolando Lara. Doctora Ana Raquel Arriaga. Doctora Alina María Alfaro. Doctora Carla Miranda Marcia. O Marcia. Doctora Madeline Vides. Doctora Cintia Rivera. Doctor Fernando Figueroa. Doctora Daniela Pineda. Y doctor Rodrigo Rivera. We would also like to acknowledge the faculty that traveled all the way from the U.S. and also one of our own, Dr. Roberto Galindo. And finally, acknowledge all you guys, the faculty that traveled from the U.S., Dr. Samuel first. They're going to place a pin on your lapel, Sam. Sam, stay there. He's very excited, as you can tell. This is a recognition from in the university's name as a thank you for you guys to come over here and share your knowledge, not only with the DISS participants, but with the UFM residents and faculty. Dr. Corey Glenn. We're trying to get Corey to move to Guatemala. He likes the weather. Dr. Taka Suzuki. And finally, Dr. Omid Termechi. Thank you once again for putting all of this together. This was a great learning experience for all of us. Photo. All right, so thank you guys once again, and please enjoy your dinner. Well done.
Absolutely, I love the program. The faculty are fantastic, the staff are wonderful, and it was a lot of fun.
Yeah, well, I mean, it's an intense boot camp, but you really learn a lot, and it's not too much. It's not overwhelming. It's not too much of the education and not actual placement. It's a great mixture of both. I feel really comfortable right now leaving after just a few short days, or really long days. But, I feel really comfortable placing implants, but not just implants. I feel comfortable with guided surgery, feel comfortable with laying flaps, sutures, everything that's involved in the implant process. Even on my end now, as a restorative dentist, I know more about how to restore better and how the placement of an implant really affects that. And so when I'm referring to my, referring doctors, I can work better with them going forward. So it's not just about me placing implants. I'm learning a lot about what to do for everything going forward.
I think this was one of the greatest programs I've been involved with. I've been teaching implant dentistry for many years at a university setting. And this program was a very intensive course, which gives a student the basic skill sets to go back to their practice and start practicing implant dentistry with confidence. There's nothing that can beat repetitive clinical work, which will give you the skills that are necessary to go back to your office and actually treatment plan, and with confidence discuss treatment plans with patients and get them to go ahead with cases. So I would highly recommend this for people that are looking to just start out in placing implants. The university setting is a phenomenal setting to learn because we have a tremendous support staff, other faculty members here that are actually doing all the preliminary work to treatment plan these cases so that we could end up coming right in and going right to the surgeries. We have a fantastic set of lecturers. Dr. Tamechi is an excellent clinician and lecturer, and he has a tremendous intro lecture on basic surgery. Dr. Corey is amazing with discussing digital planning and guided implant surgery, which you're really not going to get in other venues. So I would really highly recommend this course, and it's a great place to relax, have great fun with and camaraderie with colleagues, enjoy some great food, and see a great country. Guatemala is a beautiful place. So we hope you'll join us at our next seminar, and see you soon.
The program was great. I had the pleasure of learning a lot of surgical procedures and skills, and definitely sharpening the skill sets that I've already had.
Yeah, I've been incredibly impressed with it. You know, I halfway came down here thinking that this would be like rustic dentistry, and their dental school is far better than anything I've seen in the States. The facility's amazing. The food has been amazing. Where we've stayed was amazing, and that's aside from dental implants. The guided surgeries were awesome. I don't really know of another course doing this many guided surgeries. And just looking at the pans that are scrolling through on the TV right now, the level that these have been placed looks like it was done by specialists. So very impressive, and I think it was a great experience for everyone.